wipe over with Clinisept, which is antiseptic lotion, to make sure the skin is lovely and clean before I start. If they come in with makeup on, then you want to cleanse the skin properly to remove the makeup before you use your Clinisept. I'm going to pop on a disposable headband as well, just to make sure we don't got any product in her hair. So once you've got your headband on and you've cleansed with Clinisept, you can then load up your cartridge into your machine. So this is a 16 needle cartridge. Make sure it's in date, and you want to log the lot number and any other information on there against the client's profile, just to prove that you used in date official needles. So it clicks in like this. So you pop it on, twist it, and that's clipped into place. And we also have a cover here, which we can take off, and that protects those needles. You can also see that we've got different depths on here. So we've got 0 millimeters, 0.25 millimeters, all the way up to 2.5 millimeters. We won't be going that deep. That's more for body use. The deepest we'll go to do today is 1.5. Also, make sure you've got your gauze ready, and that way you can use the gauze to help you hold the skin taut. And also, if there is any blood, you can dab that away. So get your client to keep the head straight. The first bit we're going to needle is the forehead. The forehead and around the eyes are usually the most uncomfortable part, so I like to do those first while the numbing cream is at its most numb. That's if the client has used a numbing cream. And we're going to start off by applying some of our hyaluronic acid serum, or whatever serum it is that you're using to complete the treatment with. So we're going to turn this on. I'm going to keep it on a low level. So the speed of this goes all the way up to 6. We're going to go no higher than 2. I'm going to start off on 0.25, the most shallow of the needle length for this area because it's bony. So you should be able to feel this too much. So we're moving in an up and down motion like this, and moving along as we go. We're not holding the pen still at any point. And then we're also working side to side. And you can see we're getting a little bit of erythema there. I like to split the forehead into 2 main sections and then just work down the middle. So that's all we need to do. If you do feel like you need to do a little bit of extra, you can do diagonal as well. Now, it's good to see a little bit of pinprick bleeding like you can see here. That means you've hit the dermis. The dermis is the layer that we want to needle, where the healing and the collagen and elastin production is going to come from. We're going to get our best results if we hit the dermis. So seeing this little bit of pinprick bleeding is a good thing. We're going to work between the eyes here. We want to get rid of any frown lines. So it's important to work that area because it's an area that a lot of patients and clients want you to work on. Now turn your head to the side. So now we're going to work down around the eye here. Always make sure you've got enough of your serum on to act as a lubricant. And again, I'm keeping it on 0.25. We don't want to go deep around the eyes. Use your gauze to hold the skin taut. and we want to work outwards. So our lady here has got a mole there. We're going to avoid that. And we're going to work outwards from the eye. And this is going to target any fine lines, any crow's feet lines, and to also tighten up the entire area. Now normally you would work through the eyebrow as well, but because this lady has microblading there, because she has that tattoo, we can't needle through. So normally we would continue this all the way through the brow to help tighten up the brow area as well. So I've been around there twice. If you feel like your client needs it, you can go down round a third time. So I'm going to go ahead and do that. And then if you can turn the other way for me. So remember, we're doing the forehead and around the eyes first, because these are the most sensitive areas. It's just a good idea to get them out the way first. Head this way slightly. There we go. And you're using your most shallow needle depth. You're not going deep at all. You just want to go deep enough to hit the dermis in this thin layer of skin to stimulate collagen and elastin production and blood flow. Always pull the skin taut as you go. Using this piece of gauze is really helpful for that. I use sterile gauze because we're doing an open skin treatment essentially, and we don't want to introduce any bacteria to the skin. So what we're going to do now is we're going to work the sides of the face. And we can turn up a bit here because there's a lot of fat in the cheeks here. So for this cheekbone area, we're going to go up to 0.75, or you can go as much as 1, depending on the thickness of the skin. So I'm going to go up and down, just like I did on the forehead. We're going to do the cheekbone first, like this. Then we're going to go side to side. And if you feel like your client needs that bit extra, you can do circles. And that is all you need. And you can see we've got a little bit of pinprick bleeding coming through and erythema to show that we've treated that area. Now this bit here is a lot fleshier. You can go a bit deeper, but I'm going to stick with number 1 here. So we're going to pull the skin tight. In fact, I'm going to come from this side. I'm going to go up and down to start with. And then across. And then we can do circles as well. You can see we've got that lovely erythema coming up there. That's perfect. The upper lip, I'm going to take this down to 0.5 millimeter. No, just keep yourself there. Perfect. So we're just going to go over that twice like that, and a few circles. This is really good for smokers lines or age lines in this area. And we're also going to do around the nose. You can take it down to 0.25 if you want, but I find that the nose tends to have bigger pores and thick skin. There we go. And then we're going to move on to the chin. I'm going to turn that up to a 0.75, because even though she's quite fleshy, I can feel the bone there. We don't want to go too deep. And we're going to go up and down. And then we're going to do circles. You don't need to spend ages on each section. Turn your head the other way for me. We're going to do the same on the other side. There we go. I'm going to go up and down like this on the cheekbone. And then we're going to do circles. I'm not pressing down on the machine. I'm letting this do the work for me. I'm not pushing down at all. And I'm keeping it on number 1 millimeter depth. And again, I'm letting the pen do the work. And then I'm going to do circles. So you've got lovely redness there to show that we've stimulated the blood flow. I'm going to bring it down to a 0.5 millimeter now to do the top lip here. And then we're going to do the side of the nose. And we're going to do the chin. So there's a bit here that my client is concerned about, and it's this scar right here. So over a course of a few treatments, you should start to see that reduce. So I haven't treated that little bit yet. So we're going to pop some of our serum on. And for scars, you do want to go a little bit deeper. So I'm going to do 0.75 because the tissue is thicker. That's it, just hold your hands, squeeze. So she did find that quite sensitive. It is a sensitive area, but you can see that the machine has done its work. We've got some blood spotting. And then next time I see her, every time I see her now, that should start to get smoother and smoother. So pop your head back. We're going to do your jawline and neck now. So this tends to be the least painful area to have microneedled. So we're going to stick with a 1 millimeter depth here. I'm going to start with the jawline and work my way down the neck, side to side. Then we're going to go up and down. And then we're going to do our circles. Same on the other side. We're going to go up and down to start with. And we're going to go side to side. Then we're going to do our big circles. And you can always tell if you've missed any bits because you'll find that they're still white. So we can see we've got lots of erythema, a little bit of blood spot in there, which is perfect. But we're a little bit white here, so I'm going to go over this area here. Just a little bit back and forth. up and down, and circles. There we go. So once you've finished your treatment, sometimes they'll have a little bit of blood smearing. You just take your gauze and you clean up any blood you can see. I like to massage in any excess serum that hasn't gone into the skin already. And you want to wait 5 minutes before putting any moisture lotion on at the end, because the micro traumas that we've created, those little micro holes, need just 5 minutes to settle down and close up slightly before we pop our moisturizer on. So what I like to do is an ice globe massage using the serum.